first speaker today is Melissa Chapman. She is from the Department of Biological Sciences, and her presentation is to tell or not to tell the ethical dilemma of carrier testing for Gaucher's disease. And I'm happy to say that I am her faculty mentor. So, Melissa.
Thank you. Rabbi Joseph Eckstein lost 4 children to Tay-Sachs disease before founding Dor Yeshorim in 1983. Dor Yeshorim is an international organization that assists couples with informed spouse selection through anonymous genetic screening for specific autosomal recessive traits. The organization is devoted to reducing the incidence of lethal genetic disorders predominantly occurring in the Jewish Ashkenazi population, most commonly Orthodox Jews. Dor Yeshorim primarily tests adolescents and young adults. To safeguard participants from the psychological and social stigma of carrier status, the system is anonymous and the results of the screening are not released. When 2 previously screened individuals are considering marriage, they contact the organization and provide the anonymous identification codes they were given during blood sample collection. If both are carriers for the same disorder, they are advised against marrying. The participants are not told what disease they carry. Dor Yeshorim currently tests for 10 autosomal recessive diseases, including Tay-Sachs disease, Canavan disease, Niemann-Pick, Gaucher disease, familial dysautonomia type C, blood syndrome, Fanconi anemia, cystic fibrosis, glycogen storage disease type 1, and mucolipidosis type 4. Dor Yeshorim tests for these disease because they are more common among Ashkenazi Jews than any other population. However, there is a great variety in these different diseases. For example, Tay-Sachs is almost always lethal in early childhood. Cystic fibrosis, on the other hand, ranges in terms of severity of symptoms, and the median lifespan is 30 years old. Gaucher disease is a disease with a wide range of potential outcomes. The version most commonly among Ashkenazi Jews tends to be a milder form of the disease with later adult onset and no neurological symptoms. Some children who would test positive on a genetic test may never have clinical symptoms. In the past, Dor Yeshorim routinely tests for Gaucher disease and advised couples who both carry the trait not to marry. But today, Gaucher's testing is only done when requested. Part of Dor Yeshorim's justification is that Gaucher disease is no longer lethal because enzyme replacement therapy has dramatically improved the prognosis for some sufferers of this disease, in addition to no longer providing standard screening for this disease. Dor Yeshorim only provided information about carrier status for Gaucher disease if specifically requested by the couple, even if it knows that both are carriers. Dor Yeshorim has been charged with playing God by not informing couples that they are both carriers of Gaucher disease. Many doctors consider it unethical to withhold vital medical information from a patient, especially when this information could result in a birth of children with serious illnesses. Dr. Neil Weinreb, a world expert on Gaucher disease, asserts that besides being immoral, it is medically unsound because early detection is most effective and because some people could be misdiagnosed. It can be fatal. However, Dor Yeshorim argues that it was set up to disclose information that could prevent fatal diseases. It does not want to prevent marriages between couples when the disease is treatable. Furthermore, Dor Yeshorim seeks to provide genetic screening in a manner that is sensitive to the needs of a community in which positive carrier status for disease may result in a heavy social stigma. Its founders are concerned that many people seeking to avoid the possibility of stigma would opt out of genetic screening entirely if positive results were made available to participants. I will argue that Dor Yeshorim has an ethical obligation based on the principles of non-maleficence and respect for persons to inform couples when they are both carriers of Gaucher disease, even when they do not specifically request it. Gaucher disease was originally described in 1882 by a French doctor, Philippe Gaucher. Gaucher disease is an autosomal recessive disease and is the most common of all lysosomal storage diseases. The mutation is inherited from both parents, causing a deficiency of the enzyme glucocerebrosidase, leading to an accumulation of its substrate, the fat substance glucocerebroside. Collection of fatty material accumulates in the spleen, liver, kidneys, and bone marrow. The levels of severity of symptoms for Gaucher vary to no outward symptoms to severe disability and death. Some symptoms include an enlarged spleen and liver malfunction, skeletal disorders, and bone lesions, all of which are very painful. There are other manifestations of Gaucher disease that can include severe neurologic complication, swelling of the lymph nodes, and occasionally adjacent joints, distended abdomen, a brownish tint to the skin, anemia, low blood platelets, and yellow deposits of the sclera. However, these are not commonly found in the version of disease that are found in Ashkenazi Jews. Glucocerebrosidase is an enzyme present in ordinary cells that breaks down specific fat molecules that accumulate within a compartment of the cell. Those people afflicted with Gaucher disease lack this enzyme. Cerezyme, an intravenous infusion developed in 1994, breaks down the fat molecules that have built up in these cells, thereby mimicking the glucocerebrosidase enzyme. This therapy was developed to alleviate and reverse the many effects of Gaucher disease. The cost for Cerezyme is extraordinarily high at roughly $200,000 to $300,000 a year. Genzyme, the company, justifies their price by stating that since this drug therapy is used by a small group of patients, such a high price is necessary. Roughly 5,000 patients worldwide use this drug, with 1,500 patients living in the United States use Cerezyme. The company, in effect, has a monopoly over this treatment, forcing patients to pay this high cost with no other option. Although Cerezyme has relieved and reversed many of the symptoms of Gaucher disease, the treatment and effects for each person vary. The therapy is most beneficial for a child if treated before there is significant organ damage. The earlier the diagnosis, the more effective the treatment is. Genzyme claims that Cerezyme has increased hemoglobin levels, increased platelet counts, reduced liver size, and reduced spleen size. Cerezyme therapy, however, is not a cure for Gaucher disease. This therapy does not correct the fundamental genetic defect. For symptomatic patients to continually benefit from this treatment, they must receive intravenous fusions for the rest of their lives, even if one is feeling better. The Gaucher cells may build up and the symptoms may reoccur if therapy stops. This is a chronic painful disease, one that will be needed to be treated and dealt with for the rest of the patient's life. The therapy is quite expensive and not guaranteed to be successful. There are 4 principles of biomedical ethics as described by Beauchamp and Childress. They include beneficence, non-maleficence, respect for the autonomy, and justice. The 2 principles that are critical in this discussion are non-maleficence and respect for autonomy. If Dor Yeshorim knows that a couple carries the trait for Gaucher disease and does not inform the couple, they potentially cause harm. The couple believes that they are free from having a child at risk with the disease common to Ashkenazi Jewish population. If they have children, they have no idea that they should either test their children for this genetic disease or be aware if their child exhibits symptoms of this disease. Early disease detection is important to begin enzyme therapy before organ damage occurs. Secondly, not informing couples that they are at risk of having a child with Gaucher disease is unethical because it does not provide couples with important information that might alter their reproductive decision-making. While a couple may choose to play the odds because each child born to a carrier couple has only a 25% chance of having the disease, the couple may not want to take that risk. They may choose to remain childless or use a number of different assisted reproductive technologies currently available. First, the couple might opt to use a sperm donor who is not a carrier of the disease. Second, pre-implantation genetic diagnosis, or PGD, is technology that creates embryos using in vitro fertilization. Each embryo can then be genetically tested. Only embryos that are free of this disease are then transferred into the woman's uterus. Because on average, 75% of the embryos will not have the disease, couples who are carriers of the disease can still have healthy children. This technique is a great method for preventing a heritable genetic disease before implantation, and it eradicates the predicament of pregnancy termination after receiving an unfavorable prenatal diagnosis. However, this option is only beneficial if the couple is informed that they are both carriers for Gaucher disease. Dor Yeshorim has an ethical obligation to inform couples when they are both carriers of Gaucher disease, even when they do not specifically request it, and provide or refer the couple for genetic counseling after the implications of the dual carrier status. The organization is taking a paternalistic stance in denying the couples the ability to make informed decisions regarding spouse selection and reproductive choices. Gaucher disease, although no longer terminal, is often painful and costly to treat. Additionally, new reproductive technologies make it possible for couples to have healthy children regardless of their carrier status, but they must know about the risk before conceiving a child. Finally, children with Gaucher disease benefit when they are identified and treated early. If parents know that their children are at risk, they will have the opportunity to either test their children or watch for early signs of the disease. I wanted to thank Dr. Andrea Kalfaglu for helping and continuing to help me with this project. Any questions?